Good morning, everyone.
Good morning.
Technology is our friend. Remember that. Hey, good morning. Thanks, everybody, for joining us. Wanted to discuss a couple issues today. First of all, to be able to give you a situation update, Erica will have some good information about what's going on in our community. Also want to talk a little bit about what the ICU experience looks like. We hear everybody talking about ventilators, but there's a whole lot more to it than that, and Dr. Cameron will share that perspective as well. And then really want to talk about the biology of fear and all of the mental health ramifications we are seeing with this pandemic, kind of put it in perspective. And again, as always, we're relying on you, the media, to be able to get this information out to the public in a way that they can put all of this, what's going on and everything else they hear in the media, in perspective. So I think we'll go ahead and get started and have Erica Pitcher give us a situation update.
Hi, good morning, everyone. I just want to talk to you a little bit about where we are with numbers. So the Indiana State Department of Health just updated their case count for the day. So currently ISDH is reporting 2,159 cases across the state, which includes 49 deaths. Here locally, our case count is up to 35 cases, and unfortunately, we did have a death last night, so we are up to 2 deaths now in Allen County. We put together some slides to break down some of the data for you. So this first slide here, this is the epi curve of our data, which shows the date that we were notified of each case to show that it's still trending upwards, that we're still receiving a significant amount of cases. This next slide here shows the age breakdown of the cases that we have seen. Now, I should say these slides were put together yesterday at the end of the day, so all of these slides are based off of our case count of 30 total cases with 1 death. The 5 new cases have not been added to this data yet. So you can see about 7% of our data is falling in that 20 to 29 age range, 10% equally 30 to 49, and then the numbers start to rise from there. So from 50 to 59 years old, we're seeing about 17% of our cases, 60 to 69 years old, 20% of our cases, and then from 70 to 79, 26.7, which is the highest percentage there in the age categories. And so far, 10% have been over the age of 80. This is just a good visual to see the proportion of cases that are over the age of 50. So we've had close to 75% of our cases over the age of 50 so far. And just over half have been male at 56.7%. And then we thought it would be helpful to show what kind of outcomes people are having. So almost 70% of our cases have been hospitalized at this point. 16.7% have been intubated, and 13.3% have had acute respiratory distress syndrome. And that's all for me. Thank you.
Thanks, Erica. And that's a great segue into Dr. Cameron talking about what is ARDS and what is that experience, what's required to take care of somebody that actually does have ARDS. So, Dr. Cameron?
Hi there, Dr. Cameron. So I'm going to qualify this with the statement that I am not an adult intensive care doctor. I'm a newborn intensive care doctor, so we do not see ARDS in this sense. We see neonatal respiratory distress syndrome, which is similar in terms of how it's, the struggles in ventilating the patient, but the adults, it's a little bit different pathology that goes along with it. So I've had some correspondence with Dr. Fernandez, and this will be information that's pulled from him as well as the literature. So basically, ARDS is acute respiratory distress syndrome. And in the case of COVID-19, the virus is attacking the lung cells. And when the virus gets into the body sees it as an invader, and it wants to get rid of it and destroy it. Unfortunately for the body, especially the lungs, the the body has to attack the cells that the virus has infected. And so in doing so, the body is sending in its immune cells, the white blood cells, and it tries to destroy the virus, and it ends up destroying the cells that are in the lungs. So picture, I have an example on the right side, the having a wasp nest in the wall of your house. You know that it's there, you know that it can't stay there, so you want to get rid of it. The only thing that you have to get rid of it is a jug of gasoline. Now, obviously, none of us would do this in our right mind, but unfortunately with ARDS, the body isn't acting necessarily in the best interest of the lungs. It's acting in the sole interest of getting rid of the infection. And so in the process of doing that, you throw the gasoline on the wall to burn the nest down. And in some cases, you might destroy the wall, which could be the lung, or in some severe cases, you can also destroy the entire house, burn the house down. That would be the end result of death in ARDS in the really severe cases. So we know that with the patients that have COVID-19 that develop ARDS, these patients are at a much higher risk of dying from the disease as opposed to those that just need a nasal cannula, a little bit of extra oxygen. They're there for a few days, and then they get to go home from the hospital and recover for the remainder. But those that do have ARDS and do survive, it's not a quick process. For one, they're in the hospital for a couple of weeks on the ventilator, and then they've got to get stable enough to be able to be discharged to home or to a rehab facility, because these patients have been having support from a breathing machine, the ventilator. They've been on very heavy sedation because being on a ventilator isn't very comfortable for these patients. So in a lot of cases, they may be paralyzed. They're on medicine for their blood pressure. They're on heavy sedation. And in the process of that, their muscles become weak. So there's going to be a lot of physical rehabilitation as well as the rehabilitation of the lungs and the heart as they try to get better. And go to the next slide. Actually, before we do that, can you go back, Jana? The x-rays on the right, the top is what the normal lung looks like. And if you look at the bottom x-ray, that's the picture of ARDS. Now, these were taken off the web and the references are on the slide. But what you can see is that instead of having the nice black appearance to the lungs, it's very hazy looking or very white and fluffy. It looks like someone put a whole bunch of cotton into the chest wall. And that is the areas where the virus has attacked the lung tissue. And in doing so, it's caused a lot of inflammation. And that inflammation is meant to bring more white blood cells in to fight off the infection. But in doing so, again, it's not just fighting off the infection, it's killing the lung cells in the process of it. And when you do that, the lung cells can no longer get oxygen into the blood. They can't get carbon dioxide, the waste gas, out of the blood and into the lungs to be breathed out. And so that in and of itself is very harmful to the whole body, because you can't get the oxygen in to help nourish the body from an oxygen standpoint. And then acid builds up in the body as a result of the waste gas building up. In addition to that, you're destroying blood vessels, you're destroying lung tissue, and in the long run, the lungs are going to be less functional after they recover from it, if they recover from it. Next slide. So we asked Dr. Fernandez, what does it take to take care of one of these adults in the intensive care unit? And typically it's a nurse at the bedside. Sometimes there can be more than one nurse. They're going to be giving the medications. They're going to be monitoring the patient. And unfortunately, with these patients, because there is a high chance of them spreading the infectious particles in the air, the nurses have to be, and anybody that's in the room has to be in their personal protective equipment. And they put themselves at risk while they're caring for the patient as well. In addition to that, tube that's in place for these patients that have ARDS is in the right position, that it's suctioned when it needs to be suctioned. If it's not suctioned, then the job that the ventilator is trying to do is not as effective, or it's completely ineffective. And then you've got the intensivist, Dr. Fernandez, that's in there, helping to direct the course of care that's going on for the patient, trying to make sure that all of the things that are coming back in terms of labs, trying to make sure that the medications that are being given are given at the right doses, And if anything comes up, trying to troubleshoot the other problems, because we know that these patients don't just have problems with their lungs. A lot of times they can have problems with their heart, they can have problems with their liver, they can have problems with their kidneys. And so as the body starts to fight this, it starts to shut down other areas, unfortunately, because the body is just becoming more and more injured. The machines that the patient is on in the ICU, it's not just the ventilator. The ventilator is what's doing the breathing for the patient, but there's monitors that they're using to monitor not only the blood pressure, but the heart rate, the oxygen levels in the blood. There's machines that they're using to give the medications, the pumps to deliver the medicine. Some of them may be delivering medicine to help keep the blood pressure in a normal range. Some of them will be antibiotics to help fight off additional infection that can come from bacteria. And then in some cases, they may be trying the off-label or experimental medications to try and find something that will help fight off the infection from the virus. But one of the big things that Dr. Fernandez wanted us to know is that not only is this taking a toll on the patient, it's also taking a toll on the staff. There's a lot of anxiety that goes through having just one patient that's at risk of dying in your unit. And yes, the staff that are in the unit deal with that all the time. But when you see what's coming and what you've seen that's happened in Italy and New York, and you know that may be our unit next, it's a lot of anxiety knowing that you may have a unit full of these patients and they aren't getting better quickly. They're going to be in there very sick for a week or 2 weeks if they survive. And so the long-term mental health of the clinicians, the caregivers, is also something that we need to pay attention to. And he also wanted us to know that because this takes long, and we know that this is taking long, we have to be patient. We can't make big jumps in care unless they're obviously needed, but we have to just sit back, try and let the body recover and help the body recover by supporting it. So supportive care is the mainstay of these patients with ARDS from COVID-19. Basically supporting their lungs, supporting their blood pressure, supporting their nutrition, sometimes through a feeding tube, other times through IV fluids. And that's all I've got. Do you have any questions, or we're going to do that later?
We'll do questions at the very end. Thank you, Dr. Cameron.
Thank you.
Boy, Dr. Cameron, thank you. I think that really just, and again, I think this is important for the media to help people understand. Again, it's not just about ventilators. It's this whole concept of a suite of resources required to take care of folks during this time. And, I hear that, England's going to make 50,000 ventilators a day. Well, unless they also make 50,000 respiratory therapists, we need to keep that in mind. So again, just to help people put all of this in context, I appreciate you getting this message out. And boy, that was very well done, Dr. Cameron. Thank you. So now I want to talk a little bit about the biology of fear. As we go forward, again, you're going to be announcing another death today. We haven't yet hit our surge yet. And as we get more cases and all of this, and people start feeling the economic pinch, you can't help but feel fear. And I wanted to talk a little bit about that today and help people understand a little bit about the biology of it, but then also what you can do. And it's just important to remember that this is a biological phenomenon. Our survival really depends on both fear and anxiety. It's what allows us to react immediately. When you see a snake or a bear or a lion, whatever, that allows you don't even have to really consciously come up with a plan. You just respond to that. However, it does also allow us, when the prefrontal cortex joins in there, it does help us kind of think over perceived threats. As we may not be directly affected by COVID yet, or anyone that we know, but when we see all of this in the news, it also helps us to be able to kind of figure out where do we fit into this and figure out, a potential threat to us. The amygdala is the part of the brain that controls that emotion and the fear processing. Next slide, please. Again, when you are exposed to a fearful stimulus, either something you're seeing on TV or something right in front of you, that information is sent immediately to that part of the brain, the amygdala, again, that is involved with emotion and fear processing. And then that actually communicates with other parts of the brain that actually help you do things hormonally, neurotransmitter, all sorts of things that result in, and I know everybody's heard of that fight or flight response, which is really just preparing you to either run or do something, okay? So again, your heart rate, blood flow to your muscles, increases, all of those things to help you to be able to respond physically. What's interesting is that new research shows that this can, even before you're consciously aware of it, you can actually have these signals being sent. So again, this allows for the initiation of a fear reaction, which is a biological response, before we even can cognitively or think it through or even know exactly what we're afraid of. Anxiety also is a really important component of any type of situation like this where we're dealing with a pandemic or anything large-scale event like this. And the amygdala also plays a role in anxiety. So while fear is considered a response to a threat, anxiety involves the dread that accompanies thinking about a potential threat, one that may or may not even materialize. So it doesn't even have to be something that is actually directly relating to you in this moment, but you can have anxiety about what if it does. Other parts of the brain try, and that's we call it the prefrontal cortex, the CEO of the brain, to try and put all of this fear stimuli in perspective, but it can get overwhelmed, and that's when panic sets in. And panic happens when the whole process is really short-circuited. Unfortunately, humans are notoriously bad at assessing risk in the face of uncertainty. We're bad at it in different ways that cause us to either overestimate or underestimate our personal risk. And we're all kind of wired to actually handle threat differently. So you see people who will tend to minimize things, and then you have people that'll run around with their hair on fire. A lot of that is biologically driven and just how you're wired genetically. But again, uncertainty is something that we don't do very well with in general. And Sonia Bishop said that, I think that's made a comment about now how we're dealing with anxiety and decision-making with the pandemic. And it's that inconsistent messaging from government, media, public health authorities, all those varied recommendations really fuels that anxiety, fuels that uncertainty. And again, this is just when I mentioned to you that I think our local media have done really such a good job at setting the right tone, this is why I'm saying it, not just to flatter, but because the tone you set, the consistency in your messaging really helps people minimize that anxiety. So that's kind of really why I say that. Next slide. And toilet paper hoarding is just an example of panic buying. It's just a way of coping. It's something that people have done forever, even since 1918 or during the 1918 pandemic. It's a way of trying to control what you perceive to be an uncontrollable environment. And so, you wonder, why are people hoarding all this stuff? That's why. It's a response to a biologically driven process. So the take-home point that I really wanted to make is that fear and anxiety are normal biological responses to perceived threats in the environment. They're normal. Asking the public to not be fearful now is like asking them to not digest their food. These things happen beyond your conscious control. What we can do, however, and this is where we need your help, is guide people on how to manage this, how to minimize, how to cope. And then more importantly, know when you've exhausted your ability to actually handle this, and now we're getting into some areas where you may need extra help. Important to remember that about probably 20% of the population, if not more, suffer from anxiety all the time. And so this can actually get worse during this type of situation. So again, we want people to understand how to handle it and then how to know when they're in trouble. Before I move on, Dr. Chang, are you on the line? I just wanted to offer him. He's the expert neurologist.
Yes. Sorry.
You want to add anything?
No, this is perfect because I think a big part is human response to internal state, and starting to feel this may not be right. So Dr. McMahon, I think you put this in exactly the right place. So we need to face it. We need to take care of it. And just like you said, it's around the table. It's our effort to make sure that we try to set this difficult situation in the best possible light. So thank you.
Okay, thank you. Thanks for weighing in. So I'm going to ask Sequila to talk about what are some of the things that we can do from the Bowen Center to talk about what are some of the things we can do to manage fear and anxiety during this very stressful time.
Of course, I'm happy to talk about that. So obviously, everything we are talking about is very anxiety provoking, and it can be very overwhelming. I'm here today to say, but there is so much we can do to help with this. There is so much that we can do to regain a sense of control over this. First of all, I would say um, folks really need to limit their interaction with social media and news media. It can be very tempting to just let that constantly flow, to constantly have the television on, and that is just terrible for anxiety. People, if it's difficult to shut that off, I would encourage even using a timer. Set a timer, listen to the news for 10 minutes, and then be done with it. Um, Next, I would say we are social beings. We're designed to be in connection with other people. And while we obviously want to encourage social distancing at this point, that does not mean we need to socially isolate. So we need to be creative in the way we connect socially with each other. So whether that be through phone, video conference, whether it is for some folks that do not have very large support systems, maybe it's joining an online social support group. Maybe it is joining a group that simply meshes with your interests. So if you're interested in crocheting or painting or whatever it may be, joining a group that can fuel that part of you that needs to be fed. Next, I would say physical health is extremely important in managing stress and anxiety. Folks need to make sure that they continue to have a good sleep schedule. Again, with everybody's schedule being thrown off, with folks being home from work and home from school, it can be tempting to stay up late into the night. So we're certainly not saying be inflexible. You can be slightly flexible, but I think maintaining that sense of routine in general, and especially with sleep routine, is very important. Also, exercise is extremely important. Where possible, I would recommend that folks go outside. It is so helpful to be in nature and to be outside for exercise. Again, we have to remember to maintain social distancing. But if you have a backyard, if you have a walking trail, if you have a park, obviously we want kids to avoid equipment on a playground at this point, but wherever you're able to exercise out in nature, that is extremely helpful and important. So where it's maybe not possible, let's say somebody is in an apartment complex, maybe they don't have a park close by, exercise indoors. There are so many options available on YouTube and on the internet. Just stay physically active. And then also nutrition. It is really important to eat healthy, nutrition-rich food and drink plenty of water. And I would say try and definitely stay away from things like caffeine and alcohol. Sometimes folks gravitate towards those to try and manage what they're feeling. But those things are just really not helpful in this situation at all. And then in general, I would say good self-care strategies. If you know that listening to music is good for your soul, if you know that praying or meditating is good for you, take the time out of your schedule. Make sure that you carve it in to regularly do those things to care for yourself. And I think in general, this is a very difficult time. Everything sort of feels out of control. We don't know what's going to happen next. We don't know what the future holds in the immediate future. But instead of focusing on all the what ifs and the I don't knows, let's focus very intentionally on what can I do? What do I know? What does add value to my life? And focus on those things. If it adds value to your life to spend time with loved ones, find creative ways to do that. If it adds value to your life to create, make sure that you spend time writing a poem or singing a song or painting something. Just make sure that you engage in those things very intentionally that adds value to your life. That is a way to regain control over the situation. I would say just some added very specific guidance around children. Sometimes we forget those littles. It is very, very important to maintain routine and structure for little children. Routine and structure provides them a sense of safety and security, so that is just extremely important. Be aware of the conversations you're having around little children. They don't always understand. Sometimes we can use big words or scary words. So try and monitor and limit the adult conversation you're having around children regarding this crisis. I would also say, as I mentioned earlier, avoiding too much news feeds, too much news media, especially for little children. And that can be very scary when they're especially younger. They think in very concrete terms, and they don't always understand what is going on. They don't have the coping skills we have developed, and they don't always have the words to even explain how they're feeling or what's going on inside. So we have to be very vigilant about what we're introducing. It's very important to talk with children about what you are doing and what the health professionals out there are doing to keep them safe, because that, again, introduces a sense of control over the situation. We are social distancing. We are hand washing. We are coughing into our elbow. These are all things that we are doing as a family to keep you safe. If you were to get sick, there are doctors and nurses that can help take care of you. So very much giving a sense of safety and security to them. Talking about things that they can do, again, to help them have their own personal sense of control. You can wash your hands. You can socially distance. These are things that they have control over specifically. Definitely ask them what kinds of questions they have. They definitely have questions. They've heard conversations. They've heard news media. So whether we think they're thinking about this or not, they definitely are. And so it's really important to provide that platform where they can ask you questions and you can answer questions in a developmentally appropriate way. So obviously, the way you answer a 5-year-old's questions would be vastly different from the way you answer a 15-year-old's questions. Just be very, very concrete with the little ones. Don't give too much detail, and just limit it to answers to their particular questions in very simple, plain language. I would say with little ones, just be aware. Know that in scary, anxious times, we should expect to see anxiety. And for little children, oftentimes that translates into behaviors. So acting out behaviors, sometimes regressive behaviors where they revert to things that they used to do that they've outgrown. So, excuse me, I've got a frog in my throat. Maybe they might start wetting the bed again. Maybe they might start talking baby talk or thumb sucking. Just be aware that you will see behaviors, and that's normal. Don't react too harshly. Make sure that you give them some grace and that you provide them ways to self-regulate and to manage their anxiety. So making sure they have a little safe zone where they can go and calm down and relax. Make sure that they get plenty of exercise. Make sure that they have enough sleep and routine and structure. All those things that I previously mentioned are very, very important to littles. I think that covers it for me.
Wow, that was really excellent. A lot of good things that, especially with the children, I think a lot of people are concerned, how do we talk to our kids about this? And so I think some really, really helpful information there. And last, what we want to talk about is, let's say you're doing all of these things and yet you're still feeling really pretty anxious. Dr. Runyon, can you tell us how to know when maybe it's time to reach out and what should they do, please?
Sure. This is Dr. Runyon, psychiatrist at Parkview. So really it boils down to functioning. So, we can think about that like if you're able to tolerate and deal with your normal living environment as you always have been, but yeah, you're a little bit more stressed, that's probably a point that, this is something that can be handled by yourself or, maybe talking with a therapist or something like that. We're much more concerned when that functionality starts to change or you start to lose things. So either I'm not sleeping because all I'm thinking about is COVID-related things, or what if, you're constantly checking the news or social media trying to stay quote unquote up to date, and it becoming impairing. So if you're not able to take care of your kids, if you're not able to go to work, calling in sick even now when you're not really ill, just I can't do that. Or like I said, sleep is a big one. A lot of people, especially with anxiety, if there was a pre-existing anxiety, that's only going to be worsened with the current climate and condition. But especially for those people who have had pretty significant mental health issues, whether that's schizophrenia or bipolar disorder, depression, PTSD, the current atmosphere is very provoking for those individuals and can definitely cause some significant changes. I work here in the inpatient unit, and we have seen an increase in people who are being admitted due to, I would say, COVID-related concerns. So it's absolutely not the medical aspect of the virus, but it's the constant read. It's I'm always worried about this. I'm not sleeping because I'm thinking about it, or the people are paranoid that they're going to get it. And I saw somebody at the store who didn't wash their hands, and then they walked past me. I know I caught it from them, and that almost becomes a delusion for some people. And some people, it actually is a delusion that they think they have it because they coughed a certain period of time. And so for us, in regards to when should you seek help, it's when life has changed, when that functional level has decreased. And that's important for people to be aware of themselves, but also for us to be checking on each other and saying, hey, you don't look like you're doing so well, whether that's a spouse or a child, talking to them and saying, you're not able to do the schoolwork or things like that, or a grandparent or a friend or somebody that we're hopefully, as Sequilla said, still being in contact with and having these communications, checking on each other and being aware and having that difficult conversation of, it doesn't seem like you're doing too well. We've changed a lot of things, actually, not just Parkview, but I know Bowen Center, Park Center, and almost every private group that I'm aware of has changed to a lot of what we call telepsychiatry. So you don't even have to come into the office. It's done by virtual, either by phone or by teleconferencing like we're doing now. And those resources are still there. And actually, they're almost more accessible now because we're able to do things a little differently. We've really rapidly adjusted how we try to get that care to people. And so there's phone numbers to call. There's obviously the emergency room is still open. The walk-in clinic is still open. We're trying to keep people out of there who aren't in a severe, may need hospitalized state, just to avoid, potential contacts with the hospital as well as overwhelming us. But there's a lot more outpatient resources there, and it's important for people to know that it's okay to ask for help, that they're not alone. A lot of people are struggling with this. A lot of people are having problems with tolerating the current condition and the massive changes that have happened. Everybody used to kind of go to work, and here's your schedule and a routine, and now we don't have that routine. And we're trying to set up a new one, hopefully.
Now we have one.
And it's difficult if they're not having that routine or they're not performing as they used to. What should they do? What can they do? And it's important for people to know that there are resources out there and they can still have them even without leaving their home.
Dr. Runyon, could you and just reinforce for people how this is a biological thing, that this isn't, you're not weak, if you're not, you're not a basket case, you're not anything like that. These are real things that people are going through and that we have real solutions to be able to offer people?
Absolutely. So, if you look at people with a history of anxiety, there's drastic neurochemical changes that happen that cause some of the chronic anxiety. Sure, there's some thought process aspects and some behavioral options of how do we adjust that, but there's also a neurobiologic standpoint for anxiety, especially for depression, and even more so for people with things like post-traumatic stress disorder or PTSD. That's almost entirely a biologic response. And I know there are others talking about kind of the trauma aspect of being ventilated and waking up from intubation, and you have all these lights and pain and confusion, and that can cause worsened trauma, especially for people who have a history of it. And there's a strong biologic basis for all of these mental health conditions. And so it is definitely not a weakness. And this is a new frontier. This is completely different than what we've experienced before as a society. And so people who have these biologic changes, they're going to struggle more than the people who do not have the biologic changes. But we also have to be aware of the people who didn't have a previous history of psychiatric issues, who are now experiencing these stressors, experiencing these changes and these problems, and are developing those biologic responses, because there's some genetics, there's some situational aspects, and those things combined can lead to these psychiatric issues that are currently conditioning out there right now.
Could both of you, and I didn't
Dr.
share this with
Beckman?
you before. Yes?
I'm sorry, I just wanted to jump in real quick. This is Sequilla Libetro. I would just say too, I mean, it's so strange to me that folks think of seeking mental health help or help with their emotional well-being, that is sort of considered to be sort of weakness, or that there's something wrong with you. When as human beings, we seek support in other areas all of the time. If your child needs help with their math homework, you get them a tutor. If you need help with your taxes, you go to a tax expert. We have highly trained mental health professionals that are there to help you be at the top of your game, to feel good and be healthy. Why not utilize them? We're here for you, and we can do this in so many creative ways now, being able to do it via phone and video link from the comfort of your own home. So I guess I would just reiterate that message, that it doesn't show weakness. It doesn't show that there's something wrong with you. It's simply something that you would like to get help with.
And this is so important. This is why we're relying on the media, because for a lot of older folks, back in the day, you didn't discuss mental health issues like fear or anxiety. You just didn't do that. And it's important for them to realize the sooner you address this, the better. So again, we really want to make sure that the media gets this out there. One more thing before we take questions. There are a lot of people who have a family member in the ICU that are experiencing tremendous fear right now. What can we do? This is for both of you. What can we do as friends or family to support people who are experiencing this high level of fear and anxiety because somebody is critically ill? What could we do?
So this is Sequilla Libetro. I think, again, let's focus on the things that we can do as opposed to the things we cannot do. What are ways you can support the medical staff that are out there working with loved ones? What are ways that you can help maybe manage things back home for the person, to help care for the things that they're maybe not able to care for anymore? And again, just focusing back on how can I maintain my health and my mental health, because if I'm not stable and healthy, I'm no good to anybody else. So let's focus on the things that we can control. Let's focus on what adds value to our life. And knowing the person that is in the medical facility that you maybe are not able to be at their bedside, what are some things that you can do that they would appreciate you doing, taking care of maybe their matters or their loved ones?
Deb, can you repeat the question for me? Sorry, it cut out about halfway through and I didn't catch the whole question.
Well, I just know, actually from personal experience, that the people, the families of those folks that are in the ICU, the tremendous fear they're experiencing, and as friends and families, we want to come alongside, but what can we say and do that kind of helps mitigate this or do something to help these people that are just experiencing this tremendous fear and anxiety?
Thank you. I think it's hugely important just to be a safe place for them to talk to. Somebody that they can discuss things with. Anxiety is almost entirely a what if situation. What if this happens? What if that happens? And just being someone that can talk with that family member, that person who's experiencing it, and go through those what ifs. And hey, you know what? You can't control those what ifs, because it's really hard when you get in your head in that thinking process of going faster and faster and worrying more and more to slow it down and stop it yourself. And so knowing what you can and cannot control, it's really difficult to do when you're in an emotional situation and you feel like you have none of that control. It just starts spiraling. So having somebody safe to talk to, just to be able to discuss these issues and have those difficult conversations of, yeah, I'm here for you. Instead of saying, what can I do? Say, hey, let's talk about it. Because a lot of people, as Sequilla said, we unfortunately see it as a weakness to say, I need to talk to somebody. And if you know somebody who's in the ICU and their family, and they're probably worried, they're probably upset, reach out to them. Instead of saying, what can I do? Say, hey, let's have a phone call today. Let's just talk today. Help them in any way you can, because it's really difficult for people to ask for that help, to ask for that conversation, for that ability to just, sometimes it's just vent. Sometimes it's actually to talk through a problem. Hey, I don't know how I'm going to get my kids taken care of if I get sick. Help game plan for those types of things. So it's very helpful to, instead of just saying, what can I do to help? That person is so upset, so confused, so traumatized, and so anxious in that point, they have no clue. Instead of doing that, think, what can I do to help? And offer that help. Hey, do you want me to order you lunch? I'll have it delivered. Your kids are driving you crazy, so are mine. How about we set up them to have a conversation today at 3, or, do something and offer that help instead of asking what I can do to help. Of course, it's important to ask, because there may be something they're thinking of as well. But also from personal experience, I'm in a group chat with a bunch of my colleagues, and one of them, their family member is ill. And when she announced that he has been hospitalized, there were 7 straight messages, what can we do to help? And she said, I think we're okay, we've got it, thanks. She's not okay. It's not that she's got it. She just doesn't know what can be done, what assistance can she have. And so offering that assistance and taking a couple difficult steps to say, hey, this is what we can do. Let's set this up. Let me help you in this way is very important as well.
Boy, that's really great advice. Boy. All right. Well, I think we're to the point where we can take some questions. Thanks, everybody, for your patience. Again, I hope this information, you can get this out to folks, because I think it'll be very useful. Any questions?
Dr. McMahon, this is Corinne at 21. Can you hear me?
Yes.
Okay. I had a question that's a slightly off topic, but it's something that you've talked about extensively in the past, and that's about drive-through testing. And there is a medical practice here in town, I believe, that is starting to set that up, and was wondering what your thoughts are about that.
I'd be interested in knowing who that is. I've not heard of that at all.
It's Credo Family Medicine, CREDO, Credo Family Medicine.
I can't imagine what testing they're using, but we'll check into that. But I've not heard of that. Well, thank you for the information. We'll check into that.
Okay, thank you.
Anybody else?
This is Rebecca from WBOI. My question, and I apologize, I have not seen the charts yet. I'm called in by phone, so but those numbers and those percentages, my understanding is that the tests were really only given to people who were showing severe symptoms, correct?
Hi, this is Erica. So yes and no. So the tests are available through private labs now, which most physicians are screening those that are symptomatic, and so the sickest of the sick should be getting tested. However, all of that data is from both ISDH and private labs. So, just somebody feeling sick going to their doctor's office could be included in that data as well, not just all hospitalized patients.
Okay, so are you guys confident that those numbers, those statistics of how it affects different age groups, et cetera, are they informative, or are they merely like a snapshot of a particular point in time and might not hold up over time?
Well, definitely, this is evolving, so it's a snapshot in time. I think what it reinforced, at least to us, was initial data coming out of China looked as though it was really just affecting older folks, and to see that, a quarter of our patients that were diagnosed were younger was, kind of consistent with what we're seeing nationally. So these are just a snapshot. It's kind of helping us understand the severity of disease, who's affected, but this will definitely evolve over time, definitely.
Thanks, Doctor.
Mm-hmm.
Hello?
Yes, anybody have any other questions?
Hi, yes, Dr. McMahon. Can you hear me?
Yes.
Rosa, go ahead.
Okay, thank you. Yesterday, the governor made a point of talking about preparing for the surge. Do you have any information about how hospitals are specifically trying to do that now?
Well, they're developing their
hospitals.
own. And yeah, I know that they're definitely.
Uh-huh.
I know. Go ahead,
Go
finish.
ahead. No, I'm done.
Well, I know that they're working on it.
Rosa.
Right, Rosa.
She's trying to respond.
I know they're working on it. I can't release any of their details, but no, they're working very hard on figuring out what that looks like, how they, again, and that's why it's so important to get the message out. It's not just about the ventilators. It's about everything that goes with that, to be able to make sure all of those pieces are in place. They're working very hard to make sure they can handle the surge. Hopefully that, we've been implementing the social distancing things early enough that all the predictions may be higher than what it's actually going to be. I would certainly hope that, certainly there's going to be a surge. Certainly we're still increasing our cases, but hopefully it will be something that we can accommodate.
Thank you.
Thanks. I think Angelica had a question.
Yeah, I do. So my question is in regards to the testing and the turnaround time for that. I understand, I believe last we talked, you said that it takes about a week to get the test back. I believe the governor said, though, with the Eli Lilly testing in Indianapolis, that's taking 24 to 48 hours. Will there be a time that we see a quicker, turnaround time with our tests here in Allen County?
Boy, I sure hope so. I know everybody is so frustrated by the whole lab situation. And what I want to highlight, too, is remember, nobody's at fault. We're trying to, deal with a new test. And I think that the commercial labs were just hitting some bumps that they did not anticipate, which is causing some significant delays. I'm hopeful that we can, get this, turned around to a time where the turnaround time is sooner. But it's just really taking quite a while, depending on where you get the testing. If you use the commercial labs, I think it's taking longer right now. If you use ISDH and Eli Lilly, it's taking a shorter period of time. But it's also the volume of tests and the tests. Remember, there's very strict criteria to be able to get them from ISDH, which you have a little more leniency. And no one that I've heard of is doing anything sort of indiscriminately. They're being very careful, but you have more flexibility in whom you test when you use the commercial lab. So I think there's that tension between being able to want to get timely results. And certainly I don't think anybody knew that the commercial labs, including the commercial labs, would hit these bumps in the road so that it would take longer as long as it's taking. But, you get a little more flexibility in who you can test if you use the commercial labs. So I think that's the tension. Everybody wants results. That's basically because these results are being used for really important decisions. So everybody's trying to get the results. Hopefully this will turn around soon.
Dr. McMahon, have you had any issues with false positives? This is Rebecca
no.
from WBOI.
Yeah, no false positives. I think that would be really unlikely because really, frankly, the only people in Allen County that are really being tested. Now, I don't know about some future plan to do some drive-through clinic, But I can tell you the people now, they're sick. They should be tested. So I would be shocked if you'd have false positives. And this is the gold standard test. This would be if you do any other kind of testing down and create some new kind of testing down the road that would be antibody or something. The gold standard would always be this test because it's looking for the presence of this virus. So this would be the gold standard.
Thank you.
Mm-hmm.
Dr. McMahon, this is Dr. Cameron. One thing to follow up with what Dr. McMahon was saying, with the very focused testing that's being done right now, as was originally set up by the CDC and by the state, that really minimizes those false positives. But if we start screening people who are not symptomatic, that will increase the chance that there will be a false positive or a false negative. And so while we're still trying to sort out who the sickest are and trying to utilize the resources to determine if these patients actually have the disease, and the healthcare workers, if they're potentially infecting patients when they're exposed, we need to make sure that we're screening the appropriate people right now.
Correct.
Hello.
One more question.
Tim.
I'm sorry. Go ahead, Tim.
Tim from the Journal Gazette. I was wondering if there are options for low income, uninsured people, or people who couldn't potentially handle any copays for this kind of mental health treatment.
Do the folks at Bowen or Parkview want to chime in on that?
Of
Sure,
course.
No, go ahead.
Oh, I would say, first of all, we can definitely connect folks with insurance navigators. We work with all folks, so we take private insurance, we take Medicaid, we take Medicare, we do self-pay. So there's definitely various options out there, but oftentimes we do find that folks that have a lower income do typically qualify for a Medicaid package, and so we really push connection with a navigator, because not only do they then qualify for mental health treatment services, but they also then qualify for other medical treatment as well. So it's just a good thing to have them connected with a navigator.
Yeah, this is Dr. Ronyo with Parkview, and adding on to that, both Parkview and Park Center work with Medicare, Medicaid, all private insurances, as well as self-pay and sliding scales. And we also set everybody up who comes in without insurance, whether they're in a hospital or just connecting for initial services, also with Medicaid navigator, as Sequilla put it, somebody to get them plugged into the services, get the insurance set up, and move through. And if they're unable to work with insurance, and there are some who just unfortunately do not have the ability, based on whatever reasons, to get into insurance coverage, we work with them on either a sliding scale or a nonprofit basis. So yes, we can work with all forms of people with or without insurance and try to get them set up in the best possible atmosphere for both things.
Right, and same for Bowen as well. We do a sliding fee scale as well for folks that simply do not qualify for insurance or are not able to pay the typical standard fee.
My request would please get it out to the public that money should not be a concern about requesting help at this point in time. Our mental health community is very proactive, very willing to work with folks. That should not be a reason to not reach out for help, please.
Can I ask the mental health people if they've actually seen an increase of people specifically mentioning this situation, and have they noticed any kind of an increase in admissions or suicide type behaviors?
So this is Dr. Runyon with Parkview again. I work on the inpatient unit, and so I don't do any outpatients, so I can't tell you what our non-emergent type cases are in terms of people who are calling in for more services or trying to get connected due to either worsening or new onset anxiety. However, I can say on my inpatient unit, I won't give numbers, but I have personally seen an increase in people who are significantly more stressed, whether it's anxiety related, leading to the point of hopelessness that, well, we're all going to catch it. I might as well hurt myself before COVID kills me. I've seen people with that. Some of my people who have schizophrenia, bipolar disorder, things like that, they become very fixed on COVID-related paranoia or delusions, and I've seen an increase in that as well. So yes, I can say from my own experience here in the hospital, I have seen an increase in patients being admitted with non-medical COVID-related psychiatric issues, if that makes sense.
I would say
Thank
that
you.
holds true for an outpatient basis as well. I think what we have to remember is this is situational, and somebody can certainly struggle with a situational stressor, and they can get some quick treatment and be off and be really good again within a relatively short time frame. And then we have folks that have underlying pre-existing conditions, anxiety, depression, existing trauma conditions. And so for those folks, this is more difficult. So what's wonderful with our ability to be creative with telehealth now is we can certainly increase the amount of sessions we do per week. We can spread it out. We know with little ones, it wouldn't be very realistic to sit a 5-year-old down on a couch and expect them to talk to you for an hour. So what we can do to be creative is we can do several check-ins throughout the day. In some instances, we do maybe 2 or 3 10-minute check-ins with a child during the day. There's just a lot of additional stressors for parents and children. So we can definitely be very creative, provide just what the person needs. We can tailor their particular needs. It's not cookie cutter treatment. It's very much based on the individual need. And then get them to a place where they don't need us. That's when we're happiest, when we know that we have worked ourselves out of a job because the person can function on their own again.
Thank you.
Any other questions?
Questions? Yes. Jake Thomas with the Fox 55. Question for the doctors. What, if any, kind of mental health routines do you have your staff going through, since obviously just as stressful on them trying to make sure that they don't get sick, get their family sick, as well as try to care for these patients as much as possible?
You kind of cut out there at the end. Can you repeat that?
Yeah, sure. On the medical side, what kind of mental health routines, if any, do you have for your staff that are working with these patients on a daily basis, have to communicate with their families, as well as try and prevent themselves from catching COVID-19 and spreading it to their own families?
Are you talking about the mental health providers or our staff on the medical units, like on the ICUs, who are seeing the COVID positive patients?
The staffs that are on the front lines in the ICU.
So we've actually there's a lot of communication between Parkview administration and the rest of the hospital staff, both on the physician side as well as the staff, so your nurses and respiratory therapists and those types of folks. They've gotten a very clear picture about when should somebody quarantine, when should they get tested. We're asking everybody to do, I may not be the best person to discuss this since I'm over here in behavioral health, but they're asking people to do temperatures if they're having symptoms. Here's what you need to do. We have a command center that has a 24/7 phone number for staff to call with questions, whether that's I'm quarantined, should I take FMLA, do I need to take sick days? And Parkview has come up with a very specific structure for if this, then that, so that we can try to remove any of that anxiety. We also have our employee assistance program, as well as a physician assistance program that we have been talking about with staff. If you need somebody for immediate conversation, here's a number to call. I know our hospital administrators are doing a lot of rounds as necessary. They're not necessarily in the ICU, however, that would be due to the infection risk, but they're definitely talking with the administrative staff over those facilities and units, trying to make sure that they're getting all the support they can have, whether that's personal protective equipment or if that's shift schedules or childcare. Parkview started a group trying to make sure that we all had childcare for anybody who is struggling with that because they're still working and their children are no longer here. And so there's a group of, I think, 400 people last time I saw who are in a group of basically, I have kids, I need help. Who can help watch my kids? Or I'm willing on this day to watch kids. And so we're trying to kind of doing a crowdsourcing in-house to find out how we can do that, as well as finding external resources for childcare. Does that answer your question?
Yes, thank you.
Thank you, Dr. Runyon. Any other questions? Are we good to go?
Think so.
All right. Well, thank you all for joining us again today. We will get that data sent out to you, and we will upload it onto our website too. We plan on doing that on a weekly basis so that you have that snapshot of what our cases are looking like demographic-wise. And if you do have any other questions to follow up, feel free to email me. This is Megan. Otherwise, thanks again. Thanks again to our doctors from Bowen and from Parkview for joining us and talking about mental health. And thanks again to Dr. Cameron for giving us some information on that ICU process. Have a great day and stay healthy, please.